Hello, my name is Joshua and I'm going to be your student nurse for today. So can you state your name and date of birth for me, please? Okay, good. So what we're going to be doing today is we're going to be doing a doctor's ordered Foley catheter. That's just going to be a tube going into your bladder that's going to constantly drain urine. Now before we begin, do you have any kind of allergies to iodine, betadine, or latex? No? Okay, good. So what I'm going to do first is I'm going to get some gloves. And I'm going to do some prenatal care. I will have to expose you for this, but it's because I'm going to be cleaning your genital areas with some soap and water before the procedure. Okay, so with my washcloth, I'm going to wash the outside, and then with separate sides, I'm going to wash the side furthest, the middle, and the side closest. And with my drying rag, I'm going to wash the outside, and then I'm going to wash the side furthest, the middle, and the side closest with different sides. Now I'm going to before we begin the procedure, my patient has to be in dorsal recumbent position, and I'll do my best to keep it in this position. Okay, so now I'm going to open my Foley catheter kit. Okay. I'm going to go furthest and then open towards me last. I'm going to take my sterile gloves. And now I'm going to transfer the catheter kit onto the bed of the patient. And now I'm going to put on my sterile gloves. Okay. So now I'm going to lay down this. Under the patient. And then I'm going to unbox my Foley catheter kit. I'm going to unsheath my catheter. And then I'm going to unsheath both of my syringes. And then while I have my water syringe, I'm going to go ahead and attach it to my catheter. Okay, so now I'm going to open my iodine. I'm going to pour it onto my cotton balls. I'm going to dispose. And then I'm going to clean the patient's area with one cotton ball each, starting from furthest away, the middle, and then the side closest. And now I'm going to take the lubrication syringe and pour it into the tray. Then I'm going to take the catheter. I'm going to put it into the lubrication. And then I'm going to take the catheter, I'm going to insert it into the patient's urethra, 2 to 4 inches. Okay, I see urine backflow, so now I'm going to insert it 1 to 2 more inches more. Okay, now I'm going to inflate the water balloon. Okay, now I'm going to disconnect the syringe and tug until the water balloon hits the wall of the bladder. Now I'm going to take my hand off and I'm going to put the collection bag, the urine collection bag, onto the side of the rail of the bed. And now I'm going to adhese the catheter onto the leg of the patient, giving them ample room to move. Now I'm going to take my urine collection cup, and since I just put the catheter in, I can collect the urine from the collection port on the bag. Cap my urine, and I can put the port back. If this was any other time, I could clamp the tube and collect directly from the urine collection port to get urine directly from the bladder. Now the tube has been secured. I would, in a real situation, clean up my area, but for video purposes, I'm going to leave it till the end. But before I leave the patient, I'm going to wash the area one more time with soap and water to clean the betadine off of the vaginal area. So, 1, 2, 3, and then I'm also going to wash up the catheter. Okay. At this point, I would clean up my area. And cover the patient back up. And return them back to a resting position. And then come back later to remove the catheter. Okay. Hello, my name is Joshua, and I'm your student nurse for today. And can you state your name and date of birth for me, please? Okay, good. So what we're going to be doing today is we have a doctor's order to remove your Foley catheter today. So this may be an uncomfortable procedure, but when we start pulling out the catheter, I'll start telling you ways to help bear down with the pain, okay? We're going to get some gloves first. I'm going to uncover you so you will be exposed. Okay. So what I'm going to do first is I'm going to empty the collection bag. And I'll do that using the port on the bag. I'll empty the total amount inside the bag and measure it. And now I'm gonna attach the water syringe back into the catheter, or a new syringe into the catheter. I'm gonna let it slowly deflate the water balloon inside the bladder. In emergencies, I could pull the plunger faster, but it's recommended to let it come out by itself. Okay, I'm gonna pull a little bit to make sure everything has come out. Now I'm gonna detach the syringe. I'm gonna unadhese the catheter. And now I'm gonna start pulling out the catheter. So this may be uncomfortable, so I'm gonna ask you to hold your breath as I pull out the catheter, okay? So 1, 2, 3. And one more time. 1, 2, 3. Okay, and the catheter has been removed. I'm gonna dispose of the collection bag and the catheter into the bin. And I'm gonna wash the patient's perineal area one last time. A washcloth, I'm gonna wash the outside. And then go 1, 2, 3 with different sides. And then dry it the same manner. 1, 2, 3. And then I've cleaned up my area.